Kristen Brown, and I'm going to be doing a head-to-toe assessment for Nursing 320, Lock Haven University's Bachelor of Science program. My patient today is Mr. Robert Wild. He has volunteered to let me take a look at him and go through head to toe. So we'll start from the beginning. I'm going to first wash my hands, perform good hand hygiene. And as I'm doing this, I will say, Mr. Wild, my name is Kristen. I'm going to be your nurse for today. If it's all right, I'm going to take a look at you, just head to toe. Check all your body systems, ears, eyes, nose, throat. I'm going to use my stethoscope to take a listen to your heart and your lungs and your stomach. And then we'll check your height, your weight, your eyes, and go from there. We'll get a little bit of health history from you. So the first thing I'm going to do is I'm going to take a set of vital signs on you. Your blood pressure is 110/72. If I could, I'm going to check your heart rate. Your heart rate's 53. I'm going to check your pulse oximeter right now. Percent. Now I'm going to take a listen to your heart, your lungs, and your stomach. Would you mind sitting forward for me for just a second? Nice, slow, deep breath. In through your nose, out through your mouth. Lung sounds are good. I'm going to take a listen to your heart. Heart sounds are good. I'm going to take a listen to your stomach, listening in all 4 quadrants, starting with the right lower. vowel sounds are present in all 4 quadrants. This time I'm going to take a look in your ears, eyes, nose, and throat. I'm going to start with your ears, examining the external portion of the ear. I don't see any tympanic membrane is nice and pink in the left. Take a look into the right ear. Tympanic membrane is like a gray color on the right ear. Both look good. I did notice that in the left ear he's appeared to have a surgical incision from a skin cancer removal there. And we'll talk about his health history here in just a moment. Buitzer, stick out your tongue, please. Throat is nice and pink. I'm going to check into the nostrils and the nasal cavities. Okay. I'm going to palpate the sinuses. Can you tell me if you feel any pressure, any pain when I do this? No pressure, no pain?
No, not at all.
Okay. I'm going to check down in the lymph nodes and the glands around the neck, looking for tracheal deviation. Give me a swallow, please. No deviation there. Okay. I'm going to look into his scalp to see if I can see any abnormalities, any lesions. Okay, I'm going to check his rear neck, posterior neck. And if you would, sir, tilt your head or chin to your chest. I don't feel any deviations there. None across the shoulders. Neck is in midline. I'm going to check pulses on each wrist. Make sure they are equal. If you would, sir, take my 2 fingers and give me a squeeze. Grasp is equal in both hands. I'm going to come down to the feet. I'm going to check pulses in the dorsalis pedis. And while I'm doing this, I'm also checking for edema, which there is none. He does have some varicose veins in his ankles, in and around the medial malleolus on both sides. So if you would pull your toes back towards your head. Do you feel any pain or burning in your calves at all?
No.
No? Okay. You can go ahead and put your shoes back on. One thing that Mr. Wild has been seen for in the past is skin cancer removals. Most recently, a sebaceous cell gland removal on his posterior left scapula. What's interesting about these is that a sebaceous cell carcinoma is normally found in the eyelids and is commonly mistaken for a sty. So for him to have one on his posterior scapula is a pretty rare find. If it's okay, we'll take a quick look at that. Make sure the incision site is well approximated and healing well, that there's no drainage, redness, or other signs of infection from the incision site.
It was infected, you can see now.
Okay. The incision site does look good. At one point in time, it had been infected with a small abscess. It has since been drained. But the incision site does look like it's healing well. There is some granulation occurring here. The area is moist and red. It looks like it has good blood flow to it. The rest of the area surrounding skin is pink and intact. Does not appear to be tender. Okay. Looking at the back of his skin, also looking for any lesions, deformities, checking his midline spine. If you would, sir, just bend forward for me slightly so I can check your spine. Spine appears to be good and in midline. His skin is warm and pale, dry to the touch with no open areas, ulcerations, or redness that I've noticed. Okay, you can put your shirt back on. And I'll wash my hands again. Move some of my equipment around over here. One thing that we're going to do then also, I'm going to perform an eye test. We're going to get his height and his weight also. So sir, if you wouldn't mind coming up here and standing up against my height chart. And me being short. Coming straight back. You are 6'2", sir. That is 74 inches. And we're going to go over here to the scale. £192. Okay, and then if you would come right back here, we're going to check your eyes. If you stand at this mark, the Snellen eye chart that I have posted up here. I'll move the camera around so you can see the eye chart as well. Now, Mr. Wild, if you would, can you tell me how far down you are able to see on these lines?
Usually the top line, the DVOH, OHVCK, HZCKO, NCKHD, DHOSZ, VRN, D or B, but I think it's a DO. And now it gets a little harder for me. There's
Okay.
a Z, an N, or an H. I can't read below that very well.
Okay. With corrective lenses on, his vision is 20/32. Now, sir, if you would cover one eye and read with your left.
CS, DVOH, OHVCK, HZCKO, NCKHD, DHOSZ, VRNDO, and something ZHK, I can't read that line very well.
Okay. And with corrective lenses on the left eye, he's 20/32 as well. Now, if you'd cover up your left eye and repeat the same again, please.
CSDVOH, OHVCK, HZOKO, NCKHD, DHOSZ, VRNDO. And then it's more blurry on the right eye than the left.
Okay. If you would, sir, could you remove your glasses and tell me with both eyes how far
I can
down
see
you're able to?
CS.
CS. Okay. Thank you. Without corrective lenses, his vision is 2200. Okay. As he has gotten up, you can have a seat. As he's gotten up and walking around, I've noticed his gait and mobility, that he is able to rise from a chair without needing assistance. And he walks with a steady gait. He does not use any assistive devices. Oh, if you would, we're gonna check your eyes here real quick too. One thing I forgot. You would remove your glasses then. If you would, stare right here at my nose. Checking pupils for equal and reactive to light. Checking corneal reflexes. All right. And then you can go ahead and put your glasses back on. And then I would like you to squint your eyes real tight for me. Okay, and give me a big smile. Show me some teeth. Good. Stick out your tongue. Looking for any deviation there. All right, and if you would take your index finger of your left hand and go from my finger to your nose, trace back and forth. Follow my finger. Okay, and if you would with your right hand, same thing. Back and forth from my finger to your nose. Excellent. And then again, looking straight forward at my nose, I want you to tell me which finger on which hand is wiggling.
Your right hand, left, both, right, left, right, 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 both.
Okay, good enough. Do you have any, at this time I would ask him about his bowel and bladder habits. Do you have any troubles going to the restroom, any troubles controlling bowel or bladder habits? Are you able to take care of those things yourself?
Able to take care of them. The stream is slower when I urinate, but that has been evaluated urologically.
Okay. Do you experience any shortness of breath, any coughing, any productive coughs?
I have asthma, so I take medication. I don't get short of breath, but I have wheezing intermittently.
Okay. And you have had histories of your skin cancers being removed. You have history of any other respiratory difficulties?
No.
No? Okay, just an occasional dry cough.
Cough is the main thing. That's
Okay.
the main symptom of my asthma.
Okay, so asthma and the skin cancers, and I believe you said a heart murmur.
I have
Also.
a small heart murmur.
Okay. And you take medication for that?
I take medication for an arrhythmia, which has been well controlled for many, many years on my present medication.
Okay.
I have reflux.
Acid reflux, excellent. And you take medication for that as well,
I
correct?
do.
Okay. What kinds of things do you do to help with your reflux?
I have the head of the bed elevated 6 inches. I try not to eat after 7 o'clock or 8 o'clock at night. I take my medication regularly, and I try to sleep as much as I can on the left side because that cuts down on refluxes compared to rolling onto the right side, only that sometimes I get a little sore in the shoulder.
Okay. As far as musculoskeletal, do you have any troubles ambulating? Do you need any other assistive devices at any given time? Or?
Not really. I have some patellofemoral pain that has been evaluated, and I do exercises to keep certain muscle groups strong, and they're doing fine.
Okay. Well, I believe that's all that I have for right now. Thank you very much for allowing me to assess you. Thank you for participating. And that is the end.
Thank you.